Hey there everybody, Jarrod Fritz from Defined Therapeutic Massage, and today I want to talk about stretching a muscle that we're not very familiar with on the regular, and that is the serratus anterior and the subscapularis. It's actually a combination muscle that gets affected much with posture in upper cross syndrome, which you will see on the following slide. As you guys saw in the slide, upper cross syndrome has weakness in the back and tightness in the front, which allows the shoulders to go forward. And this can cause a lot of issues because it can compress nerves and vessels in the shoulder girdle area. But also, there are two muscles that sit in between the shoulder blade and the rib cage, and that's the serratus anterior and the subscapularis muscle. They lie right up underneath the arm right here, as you'll see in the following slide. As you saw in the past two slides, you saw the serratus anterior muscle that sits on the rib cage and goes all the way back, and then you saw the subscapularis muscle that sits underneath the shoulder blade itself. Now, from upper cross syndrome, from being slouched forward like this, those two muscles compress very, very tightly, and it can restrict motion of what is a natural motion of the scapulohumeral rhythm of the arms going above. Because they compress together and they cause tightness, it restricts a flow of that shoulder that you'll see in the following slide. As you saw in the slide, that restriction of movement is going to require other muscles such as the upper trap muscles, the deltoid muscles, even the bicep muscles to do an overload of work, which will cause more pain and more discomfort and more postural imbalance. So what I want to do is I want to show you a quick way to get some mobility and some stretch back into the serratus anterior muscles and that scapulothoracic joint itself. Now, because the scapulothoracic joint sits back here, it's really hard to stretch sometimes. So I'm going to show you a slow progression of how to create some movement into that joint and create a stretch back there and help keep your posture in a more upright position. The first thing you can do is simply hold your arms out in front of you, retract your shoulders, pull them back as far as you can, and then push them back out. Anywhere from 10 to 15 reps. What you want to imagine is that in between your shoulder blades, if you placed a pencil, you're trying to squeeze that pencil together and come back out. Now, once that becomes comfortable and easy, you can move into a slightly inclined position and do the same thing. It's kind of like doing a push-up without bending your elbows. So as you come back, you squeeze together, and as you push out, you should really feel it kind of up in here getting activated. It's a pretty simple, pretty easy mobilization stretch to keep that nice and mobile so your scapulothoracic or scapulohumeral rhythm is not jeopardized. You don't have a lot of extra pain in your shoulders. I hope you enjoyed the video. I hope it helped you out. Stay tuned for some really cool stretches coming to you in the near future, and I hope you have an awesome day. Thanks for tuning in.